Okey, baiklah. Hadirin yang dihormati sekalian, jam pun dah menunjukkan 9:32 pagi. Jadi, kita akan bermula dengan sesi perkongsian kita pada pagi ini. Sebelum itu, sekali lagi, Assalamualaikum warahmatullahi taala wabarakatuh dan salam sejahtera semua sekali yang sedang mengikuti sesi perkongsian ilmu Harvard Medical School Leadership Course, How to Apply and What to Expect. Jadi sebelum tu saya perkenalkan diri saya Hazlina bersama dengan Cik Norayu, Cik Sazali dan juga Cik Datu Jamal. Kami merupakan kami daripada unit kepimpinan dan juga pengurusan bahagian pembangunan kompetensi Kementerian Kesihatan Malaysia yang juga selaku urusitir dan juga penyelaras untuk sesi perkongsian pada pagi ini. Jadi sebelum saya teruskan dengan sesi perkongsian, sedikit info yang mungkin saya boleh kongsikan yang mana untuk makluman sesi perkongsian ini dibuka kepada semua warga KKM daripada pelbagai grade, jawatan dan juga skim perkhidmatan selama 1 jam. Jadi sepanjang sesi ini berlangsung, mungkin ada antara warga KKM yang mungkin yang nak bertanya soalan, boleh diajukan pada akhir sesi nanti dan soalan berkenaan boleh diajukan melalui chat. Di ruangan chat boleh kita typekan soalan yang kita nak tanya. Kemudian e-certificate akan diberikan kepada semua yang mengikuti kursus ini dan pautan kehadiran akan diberikan dari masa ke semasa ketika sesi ini dijalankan. Jadi mungkin sedikit latar belakang mengenai sesi pada pagi ini. Tujuan utama sesi ini diadakan adalah sebagai panduan dan juga inspirasi kepada warga-warga KKM untuk memohon dan juga mengikuti kursus-kursus yang kursus-kursus jangka pendek khususnya yang ditawarkan oleh institusi-institusi antarabangsa. Dan sedikit mengenai penceramah kita pada pagi ini. Beliau adalah yang berusaha Dr. Sazalin Deliza bin Husaini yang merupakan pakar pembedahan am di Jabatan Pembedahan Am Hospital Tawaf Sabah yang juga pernah mengikuti kursus kepimpinan di Harvard Medical School. Jadi, tanpa berlengah dan dengan segala hormatnya, saya berjemput Dr. Sazalin untuk meneruskan sesi perkongsian pada pagi ini.
Terima kasih Urus Setia Cik Norayu daripada bahagian pembangunan kompetisi KKM. Okey, sekarang saya share slide sekejap. Okey, slide boleh nampak? Slide boleh nampak?
Okey, boleh
Okey,
nampak Doktor?
boleh
Jelas.
nampak. Okey. Okey, Bismillahirrahmanirrahim. Alhamdulillahirrabbilalamin. Wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa baiti wa sahbihi ajma'in. Rabbi shrah li sadri wa yassir li amri wa hlul 'uqdatam min lisani yafqahu qawli. Assalamualaikum warahmatullahi wabarakatuh. A very good morning to everyone who's attending this sharing session. So thank you again to Cik Norayu for actually coming to Urstia and also inviting me to share this talk a bit about the Harvard Leadership Medical School Leadership course. So again, my name is Azalin Deliza. I am one of the general surgeon based in Tawa Hospital. So I had the opportunity and privilege to actually join this session or this course in 2023 and completed the course with a certificate in 2024. So we've had the certificate in February, so it's quite recently. So I think the aim for this sharing session is actually quite good because I myself, when I joined the session, the course, I was actually unsure what to expect regarding this course. So because this is actually quite a big topic, the only thing that we know about leadership is probably some basic things, and at the same time, it's a 1 year course. So what is it about? So how to go upon it? Is it possible that we can do our daily job and actually still go for the course? So those are the questions that we had before joining in, and along the way still have other questions. So for me myself, the course that we attended was actually called Leadership in Medicine Southeast Asia 2024. So that's the connotation that we were given. And it is actually a collaboration between Sunway University and Sunway Medical Center with Harvard Medical School. So the good thing about this course is that the workshop that they arrange is done. Most of them is actually done here locally in Malaysia. So because some of the leadership course in Harvard, some of the workshop that they arrange need to be attended elsewhere. So for example, one of them is you have to attend in London, for example. So that may be something that will cause a bit of hesitancy to join. So in for this course, what we're going to go through is actually some of the thing is that what is it? What is this Leadership in Medicine Southeast Asia course is about? What are the objectives? Who is it for? And then we'll talk a bit about the contents of the course. How is the course being done? Any other activities? How to apply? So that's about it. So again, what is it? So the course, if you go into the website, it's mentioned as a 1 year certificate program. So it's not a diploma, it's not a degree. But after you receive the 1 year certificate after you receive the certificate, you are actually included into the alumni. So you can be considered as an alumni of the Harvard Medical School. So for this course, it caters mainly, there's one of the advantages that it caters mainly the Southeast Asia region and also the Asia Pacific region. So for this course, for my batch, for example, we had about 70 plus students. We have a majority is from Philippines, Malaysia, and for our batch is Mongolia. I think the biggest batch is for us is actually from Mongolia. So the Mongolian government, the health ministry of Mongolia, they actually sponsor about 20 plus students to actually join the course. So we had a majority from Mongolia at that time. And also we had some from Australia, we have some from Japan, India. So quite a good mixture of uh, variety of students that joined the course. And the learning model is what they mentioned here is actually live teaching. Live teaching is mainly online teaching or workshop teaching and pre-recorded online lectures. So pre-recorded meaning you can actually watch the lectures at any time of your convenience, whether you want to stop it midway, whether you want to repeat it later. Okay, and then there's 3 intensive courses. And when they say intensive, it's actually quite packed workshops. So the workshops, there are 3 intensive courses. 2 of them are actually done in Sunway University, so in KL. And the third one is in Boston, so Boston, USA. So for the third workshop, they combine it with the graduation ceremony at the end of the workshop. So it's a 2 in 1. So the workshop that we had to go through was face to face. So we have to attend the workshop physically and the rest in between. So we started off in February 2023 with the first workshop and end in February 2024 with the third workshop. So we have in between that is another second workshop. And all along throughout the year, we have an online communication on how to actually go upon the course. So if you want to talk about the objective of the program, this is what is mentioned during on the website regarding the program objective. It's difficult to bold what are the important parts in this objective, so it's a bit busy, but actually what it mentions word by word is actually what it is. So it's first part is actually building skills in teaching. You want to develop a curriculum, how to do that, writing assessments, creating lessons plans. That's one part of building skills. And then, of course, leading, managing complex organization, managing crisis. We just had COVID, how we want to approach that, what we learned from that. So how to manage crisis, quality and safety. So and then this third part is actually something that is probably less relatable to us, but it's good to know, is budgeting. Budgeting, and when they teach about budgeting, it's more of something more towards a level of how a CEO should be thinking, how to open an organization or how to open a service, stop a service, how to, do we need to hire more staff, reduce staff, all those things to actually limit losses, all those sorts. Others is developing skills, how to negotiate, how to have a difficult conversation with problematic staff, providing feedback, fostering creativity within the department, leading healthcare teams, all those sorts. All those are actually the objective that actually we have multiple lectures on it. So with that in mind, who is it for? It sounds like everyone can benefit from this program, but it mainly caters for those senior and mid-level faculty, meaning all the executive level CEOs, those who are in administration, okay, those who deals with human resource, money, executive roles, all those sorts. So because the course is quite extensive, and I mean it's quite comprehensive and also widely extensive. So most of the part is actually relatable to us, and there are parts who are actually not very useful for us or with something that we can utilize even after we've gone to the course. So that's why it's actually mainly towards the administrative management. And even if those who are clinicians, they mentioned that those who are transitioning from full-time clinician into a teaching faculty, administrative management, executive role, they are the ones who are actually gonna benefit the most. And if you are still a full-time clinician, probably you can actually use only probably partial of the things that they have taught. Okay, so going into the workshop. So again, the workshop is divided into three. So there are main topics that are mentioned in the workshop that are probably overlap or even actually on top of those that we go through online. Okay, so for those who thinks that this talk is a bit too heavy or anything, I actually included pictures of the journey I had gone throughout the workshop. So this is actually picture of my Airbnb when I was in Boston. Okay, so workshop one and two is in Sunway University. So it's in KL. So it's in the graduate center, Sunway University for workshop one and two. You can see from the picture that we have a wide variety of students and they attended the course physically. And Sunway University is actually is a quite impressive university that we will go through. It's very conducive for studying, a lot of greeneries, a lot of amenities. So it's actually a good place to have a course there. And workshop three is in the conference center for Harvard Medical School. This is a picture of the conference center, Joseph B. Martin Conference Center. And these are actually lectures done within the Sunway University for lectures for workshop one and two. So when we talk about leadership course, what is it that we're going to learn? So for us, kita tengok banyak cerita leadership. We actually heard a lot about leadership. So do we really need 1 year to learn about leadership? So that's something that comes up on my mind when we attend this course. So a lot of times when we share through WhatsApp, through emails, we think about leadership as these cartoons. Boss will say I, should be saying we. Leaders should say let's go instead of asking people to go, blame, fixing, empower, take advantage. All they are, these are difference between boss and leaders, or bosses will command, leaders will ask instead. Okay, so probably in our mind, this is what we think about leadership. So, but in reality, there's a lot of components on the topic of our leadership. So some of the topics that they mention is probably can be broadly categorized in these four topics: leadership styles, adaptive leadership, transformational change, creative thinking. All these are just some of the topics that is mentioned during the workshop. So, for example, for leadership style, they will talk about a few lectures. We'll be talking about types of styles of leadership, which type are actually predominant in us as a leader. So when we're going to use certain other types of leadership style, and on top of that, not talking about you yourself as a leader, you have to talk about the people who you lead. So what type of people actually needs what type of leadership styles? Okay, so that takes a few lectures in itself. And there are things that when we talk about the people we lead, we have this Dunning-Kruger effect. We'll talk about those who has different competency level with different confidence level. Usually those who are low in competence, we have the highest in confidence, or how do we want to tackle that? How do we want to actually tackle those who are actually quite okay in competence but low in confidence? Okay, so all those sorts are something that has been touched in the workshop. Again, another one is adaptive leadership, something that is probably less exposed to us. Adaptive leadership, whether when there are challenges that we face as a leader, we should categorize it into a technical or adaptive. Technical is more straightforward, it's evidence-based, easy to rectify, short-term. Adaptive is something that's new. We're not sure what to do. We have to test. We have to experiment. We have to discuss. So all these things are something that we learn during the workshop. So we talk about paradox of trust. To be successful leader, you need trust from from the people you lead. But at the same time, if you want to gain trust from the people that you lead, you need to actually fulfill some of the requirements or the expectation of the people you lead. So how you want to go upon this, or how to you want to break the cycle of this paradox? Okay, so that's something of the thing that we mentioned. Adaptive disequilibrium. So we talk about how to affect change to an organization. So we talk about this. If you look into this graph, you can see there's a threshold of change and a threshold limit threshold of tolerance. So we try to keep our staff or the people within this blue band of productive zone, because a lot of times people will tend to be in the comfort zone. When you are in the comfort zone, you don't tend to want to actually affect change. There's no innovations. You don't want to do extra work. You want to do the most minimum bare amount of work that we can do. So there's no change in there. So trying to affect change and put a little bit more stress on the system will actually be productive in the system. So, however, bear in mind there is a limit of tolerance. Some people, the limit of tolerance is lower, some is higher. So, if someone is actually beyond their limit of tolerance for probably too long, then there will be a sharp dive into the comfort zone, and probably they will stay in the comfort zone for a longer period of time. So all these things are something that we discussed during the workshop. So transformational change, how to develop change into the system. So we talk about how the sorted system, what is the difference between positional leader, situational leader, performance gap, opportunity gap, what are the elements, steps for change. We talk about creativity in thinking, and creative thinking. Of course, there are different types of creative thinkings. When you want to be critical instead of creative, when you want to be creative instead of critical, what convergent and divergent thinking. So these are actually the things that we discuss. And within the creative thinking, the types of creative thinking, we have divergent, lateral, aesthetic, system, inspirational, when we want to use each one of these. So there are a lot of things and quite a number of lectures on leadership in itself. So that's why probably it took us a year just to talk about leadership. So outside the topic for leadership per se, there are a lot of topics on quality. And quality, we talk about performance improvement. So we talk about change. And when we talk about doing leadership, we want to do change in the system to improve system. So how we want to measure that. So performance improvement from there. Effective tool for feedbacks. Okay, how you want to do feedbacks, when to do feedbacks, how you want to monitor feedbacks. There's a big topic also on lean healthcare, talking about PDSA cycles, safety policies, self-appraisal, which is sometimes lacking on our side, strategic decision making, how you want to be effective, how to want to work in global teams, crisis leadership, talk about. And then there are a few real case discussions, mainly on investment, leadership crisis, transformational leadership. So real case discussion are actual cases from worldwide. One of the topic that I remember is actually we talk about a mining incident. Okay, mining. So the mining incident is a disaster where the one of the mining shaft collapsed, where there's about 40 people trapped in the mine, and who actually going to assume the leadership roles. So how they want to actually organize this rescue effort. So we talk about those outside the mine, trying to rescue those inside, and how many agencies, how many experts, how do they get together, what are the discussion, what are the quarrels they had, and how to actually achieve that goal, that same goal. And then of course we have to talk about the leadership inside the mine, all of those 40 people, who actually took charge, who actually became the leader, what are the decision makings, who actually wants to listen, are there any groups deviating from there, how many leaders are there. So we talk about all the case discussion there. So And in the end, actually, it's a successful mission where all the miners actually was saved. It was a Chilean mining incident. Okay, so other topics: importance of health records, managing leading organization culture. Okay, trust building and conflict handling, also something very useful. Okay, other heavy topics that we gone through is actually something like future healthcare system. Future healthcare system is actually quite a big topic, probably ministry level topics. Healthcare innovation, human-centered design. So whatever designs of or innovations that we have, it should be human-centered. The easiest example I've given is actually a door with a handle. Okay, sometimes we have a door with a handle. We pull on the handle when actually it's actually supposed to be push. So even though if you write push there, we'll tend to actually pull on the handle. So that is actually not design human-centric. So that's why sometimes now doorways, we can see that one side of the door is there's a flat panel and the other side is actually a handle to pull. So the flat panel is to push. So those are actually human-centered designs. So we had that topic mentioned during the workshop. Of course, one of the main advantage of this course is actually networking because there are so many students from other countries, other backgrounds. So this networking is actually the ones helping us to actually broaden our minds on how to actually manage as not just as a leader and just also as an organization. One topic also new to me during the course is actually meta leadership. So meta leadership is I think we had one full lecture of meta leadership. It's actually being a leader beyond our organization. So there are multiple stakeholders. So other stakeholders, how we want to be a leader beyond our organization and affect change there. So it's actually also a heavy topic there. So all these are actually some of the, or most of the lectures that we go through during the workshop. So that's why I say it's actually quite an intensive workshop. The workshops are actually about 4 days for each workshop. So for 4 days, we are actually being catered with all these topics. So outside the workshop, we have all this majority of the time is actually through an online content. So for online content, they use this program what we call Canvas. Canvas is actually something like a learning management system where they cater teaching for schools, for colleges, and also universities. So Harvard actually uses this system, this Canvas system. So we are actually registered into the system, and this is our homepage for the system. So you can see that from here, there's a lot of things that can be done actually just via this platform itself. So we can actually have announcements read there. We can actually talk to the faculty. Okay, email the faculty if we have any concern. Okay, we can look into the syllabus there. There's modules there. At the end of each module, there's quizzes. So even our exams also, we actually do online exams through this particular platform. So if you choose one of the tabs there, for example, the modules, the whole course for online course actually is written here 7 modules, but 2 of them are actually the same topic. For example, module 1 and module 2 is actually module 1 is actually 2 parts of the financial management and control. And then also there's module 3 of patient safety. So they divide into parts. So there's total of 7 modules: financial, quality, patient safety, innovation in healthcare, foundation in performance improvement, strategic planning for human resource, and transformational leadership and coaching. So within all this module, there are probably a total of about 30, 34 lectures saved inside as a pre-recorded online lectures. So for example, if you go into the quality module, the frontline process improvement, inside this quality module, there's 5 lectures. So we need to finish the lecture within a certain period, and then we'll have to actually do the quiz at the end of the module. So you can see here that July 5th is actually the deadline for the quiz. So we need to finish that prior to that, before we can actually go to the next module, the module 3. There you can see that at the right hand side here, there's a prerequisite is actually the module 2. So you have to finish this before you can go next. And they're not going to open all the modules at the same time. Okay, so there will be deadlines where they will open the third module and then the fourth module and so on and so forth. So for example, if we go into the frontline process improvement from from the second module, you will have this uh, page where you can actually see the pre-recorded lecture. You can see on top the top is the transcript of the lecture is also downloadable if you have problem with the audio. Okay, so this is how you can actually stop, revisit the lecture anytime you actually want. So on top of that, the other tabs you can go through and see what are the syllabus, and you can look into the workshop. So for example, here, workshop 1 is in February, workshop 2 is in October, workshop 3 is also in February. Okay, where is the workshop located? And within the tabs, you can see the session, what are the detail, what are the itinerary of the workshop. It's all inside this platform. So at the end of each module, there's a quiz. So you can see all the list down of quiz. So there's one midterm exam, and then there's one final exam. So you need to pass within the minimum required marks for each exam. So you can actually revisit all the exam questions from this tab. Okay, so on top of that, after you finish all those, there's also another project that what we call the capstone project. Capstone project, why is it called a capstone? So actually capstone is something like a keystone. So it's actually the last piece of stone that you put on top of the structure before the structure is complete. So what it does is actually you need to propose a topic, okay, a local problem, and propose on how to improve it by using everything that you have learned during the course. So that's why it says here to demonstrate the ability to integrate and apply whatever that we learn during the course. So we need to actually we need to actually develop a project and submit the project, and this is actually one of the requirements to actually complete the course. So topics is very open. These are some of the topics that they mentioned during the from previous projects, something like risk reduction strategies, improving patient experience, lean. There's two on lean, implementing lean for patient admission, lean for overcrowding in ED. Okay, mental health support for doctors. So these are some of the topics for a capstone project. So everyone are actually required to submit a project, and 10 of the best topic or project will be presented to everyone online. So they will choose 10 and they will present online, and we all will actually listen to the project. And then out of that 10, they will actually select three topics or project or presentation, and they again have to present during the third workshop in Harvard. And from there, okay, so from there, start. Okay, so from there, the top 3 will actually get a special certificate showing that they have their best project. So you can see here, this is the top 3. The first 2 recipients are actually from Malaysia, so they've done a sprout. So one is a pharmacist, Dr. Wamayi, and also Dr. Mohana, the ophthalmologist, and the third one is a representative from the Philippines. So that's actually all the curriculum on the course itself. So are there anything else that's actually offered during the course? So within the first workshop, actually they've allocated time from the first workshop to actually visit Sunway Medical Center. So I don't have much picture on the medical center itself, but I can say that it's actually a quite impressive center. Good the good facilities, I think very up-to-date facilities. So we had a look into the Sunway Medical Center, which is just next door to the university. So that's for the first workshop. The second workshop is actually they've arranged somewhat an alumni session. So we get to see all the previous alumni for the course, for the Harvard Medical School leadership course. So from there, we can see that some who are actually it's quite surprising that those who came are actually not only just from Malaysia, some of them are actually from overseas, just came for this alumni. And of course, the third workshop is where the most of the tours are actually people are actually waiting for. So during the third workshop, on top of all the lectures that we went through, there's a tour of um, certain sites of Boston. So the first tour that we were brought to is actually the Massachusetts General Hospital, also known as Mass General, okay, or MGH. So this is actually the hospital, the biggest teaching hospital for Harvard Medical School. It is probably it's the original teaching hospital for Harvard Medical School. And so we went to see what are offered there. And the highlight is actually the Ether Dome. The Ether Dome is just next door to the building that I showed. So the Ether Dome, you can see there's a dome on top. So why it's called an Ether Dome? So it's actually famous for the first public demonstration for general anesthesia. So they use ether to actually do a surgery on a patient. So we get to see that. So the building itself is, uh, I think it's from the 1800s, 1811 or something like that. Okay, so it stands until now. So this is the ether dome. This is actually the surgical complex. You can see from there, there's a big picture. Behind that is actually a representation of what it was called the Ether Day. So the Ether Day is actually the first time where publicly someone is actually done surgery under general anesthesia or under sedation in our term currently. So that's where it's actually being done. It's in 1846. So we get to see that during the tour. So this is actually our class visiting the Ether Dome. And why Ether Dome? Why surgeries are being done here is actually one of the reason they mentioned is actually for lighting purposes. Okay, so for surgery you need a lot of light, so they do the surgery in the light, I mean in the dome itself. Okay. So what else is inside? If you can see the statue there, it's been there since if you look into the picture, this same statue is actually still there since the 1800s. And something very interesting, there's an real Egyptian mummy here inside the Ether Dome. So why it's there? It's mentioned that someone brought it there just uh, it's for money making visitations. Okay, so to support the financial requirements last time in the 1800s. So from the earlier picture, we can see there's a garden in front of the Ether Dome. So this is actually the current picture. There's renovations there, and you can see that dome is up there. Okay. The other tour that we went to is actually the museum tour for the MGH, sorry, MGH. So here, the tour, you can see multiple historic items that they put on display. For example, here on the left side, you can see this is a ancient amputation tools. And here, when we say we need to carbolize, this is the first carbolic acid sprayer. Not the first, I mean the early invention for a carbolic acid sprayer. So when they know that carbolic acid can be an antiseptic and reduce post-operative infection, this is the initial invention. The right side is an iron dome, okay, mainly used to treat polio patients. Some patient requires to be inside this dome throughout their life. It's something like a primitive ventilator system. And below here is the etherizer. This is where they put ether and actually put patient into sleep, as mentioned just now in the ether dome. So this is the apparatus. And of course, last and not least is actually the graduation ceremony during the third workshop. So the graduation ceremony is held in Harvard Medical School. So we have quite a number of attendants. If you have time, then probably you can think about visiting other places around Boston. So one of the place that I personally visited was Isabella Gardner Museum. It's actually quite near walking distance to the conference center. It has a very interesting history. It's owned by Isabella Gardner. It's built in 1901 or something like that. So here she's a millionaire where she collected art stuff from all over the world and actually developed this museum and donated this museum to the public where with the condition that everything inside them is not to be sold or not to be added or not even to be renovated or change its place. So it's been like this since she died in the early 1900s. So there's you can see quite interesting. And one of the most interesting thing about this museum is actually the biggest art heist or robbery to date in the world is actually happened in this museum in 1990, where a total now they said about 600 million US dollar worth of artwork is stolen and still haven't been found. And they still give a $10 million reward to those who can uh, offer some information regarding that heist. Okay, you can see the stolen artwork and still there. Okay, and there are some medieval Arabic inscription on top of all the Western inscriptions. Okay, so are you sold? Are you want to join? Or you want to go through the course? Okay, so how to enroll? So enrolling is actually through through the website, Harvard Medical School. Only that currently our batch is actually the last one that is being called Leadership in Medicine Southeast Asia. So they rebranded into a Leadership in Medicine program at Sunway University. So Sunway University actually is in collaboration with Harvard. So but all the faculties or the teaching staff is actually from Harvard Medical School. Okay. So if you can see from this, the program is actually I think the next batch for registration will be for next year. And something that you cannot see currently is actually how much it costs. So actually the cost for the fee for the course is actually 15,900 USD. 15,900 USD. So, however, for us, those who are in low or middle income countries, they do give tuition assistance. So they can give discounts up to 50% of the original course fee. So from there, but to do that, you need to write something like an essay to actually say why you justify actually to get that discount. And the requirements is all listed in the website. You can see that from the application requirement. They just need your contact credential, your CV. They need a short essay to say why you actually need to join the course, letter of recommendation, and if you need the tuition assistance, submit at the same time. And if you can see, if you go to the website, the next batch of the course is actually going to start in workshop one next week. So they've changed the date from February to November. So the next batch is actually going to be in November instead of February. So it's going to, by the time you go to the third workshop, it's going to be in winter in Boston. So probably you're going to see snow at that time. And also the second change that they made is actually for workshop number 2 is no more physical workshop. So probably you need to go to Sunway only for workshop 1. Workshop 2 is going to be virtual, and then you're going to attend physically again in workshop 3 in Boston. So those are the two main difference. So if you think that after going through the courses that you think that's probably something that is not suitable for you, or some of the topics are actually not suitable for you, there are other leadership courses in that Harvard provides. So one of them is surgical leadership. You can see the tuition is a bit higher, 18,900. And here, this is one of this is one of the workshop that I mentioned that needs to be done elsewhere. So for this particular one, it's I think second is it's in London for the workshop, and the third workshop is the same that we're going to go to Boston. And another one is safety and quality informatics and leadership. So this is also another leadership course that's offered by Harvard. So the other thing that I haven't mentioned, for me personally, the course for the leadership and medicine course that we attended, uh, yearly Sunway University and Sunway Medical actually sponsors a few students to actually attend the course without paying the course fee. So usually what they do is actually they offer KKM. I think for our batch they offered 3 slots for joining the course without the course fee, but still need to pay the uh, the travels and also the all the uh, traveling and also the stays. Okay, so they just waive the course fee, and how to get that is actually something that's not well, no, we're also not sure. So, for example, for our batch, we had 3 from KKM that joined the course, and one of them is me. And the reason why one was offered to our fraternity, the surgical fraternity, is actually to help establish the global surgery initiative in this part, the Sabah and Sarawak. So that's one of the reasons why it was offered to the surgical fraternity. Prior to that, it was offered to other departments. So probably you have to be on the lookout on who actually being offered to. So probably you can ask your head of departments or probably from the ministry itself on when actually or where actually you can actually ask for or try to ask for a slot whether you can go uh, into the sponsorship program. So that's how I actually joined the program without actually knowing much about the program initially. Okay. So before I end, this is our batch. There's, I think, about 70 plus of us. This is the Malaysian batch. Okay, there's about 15 of us. And these are 3 of us who are actually representing KKM. There's Dr. Mahesh and also Dr. Nazwana, both from KKM. Okay, with that, this is my final slide. So before I end, I'd like to express my gratitude to Encik Muhammad Sazali, Encik Nur Ayu for actually inviting me to join this sharing session. And I'll welcome any question regarding the course if there are any. Okay, thank you.
Ya, terima kasih Dr. Syazalin di atas perkongsian sebentar tadi. Dan kalau kita tengok kat ruangan chat ni, ada beberapa soalan yang telah pun diajukan. Mungkin Dr. Syazalin mungkin boleh menjawab antara beberapa soalannya.
Okay, so talk about the first question is whether it cover hospital component, also public health. Okay, so as I mentioned, it's more towards public health and also administrative uh, offices rather than hospital itself, because hospital itself we also always divide ourselves into the quality department, clinicians. Okay, so the if you can see the topics from for this course encompasses everything. Okay, how to be leader between organizations, uh, safety, quality, how to monitor, how to handle HR, financial. So yeah, so it's actually more beneficial to public health rather than the hospital. And public health, and if you talk about public health and hospital or healthcare in general, probably it will be more beneficial to private setting more towards than a government setting. Another question, what sort of international leadership can be applied to the local level? Which part of the local leadership? So it depends on the question on which part of the curriculum is relevant to local leadership depends on what position that you hold. So actually, for it is quite comprehensive. They talk about almost all aspects of leadership, and as mentioned, even financial is also touched upon. So you part of the curriculum can be used in, I mean, for your any organization or any officer will benefit from the curriculum. But the thing is whether it is actually you're gonna utilize the whole curriculum. Okay, that's the other issue because you are going to spend quite a significant amount of money and probably you're gonna probably use only part of the uh, curriculum cost. So that's where you need to balance between the two. Okay, so a lot of times when we talk about the cost, one of the main aspect that I mentioned just now is the networking. Okay, so when we have the proper networking, then we can actually probably have some easier management skills, and if we have all these contacts from other departments. Okay, so well, that's one thing I hope I answered that. Could we have the contact number of a person or Ministry of Health? Actually, the contact number, okay. I got the invitation. It's actually from straight from DG's office. So it was from our previous DG, okay, Tan Sri Noisham. So I'm not sure whether there's any other person below him who actually uh, can be contacted to actually join if there's any more of this sponsored slots. Okay, so from there, from what I know is that from the DG's office, they will elect certain head of services to actually choose someone who they think is probably able to actually join. So that's how I know about the cost. Okay, so I'm not quite sure whether there's a specific person. So from what I can tell is probably we can just be on the lookout if there's an offer. Okay, so if there's an offer for that, then probably we can be on the lookout and probably try to be more proactive in joining. Because for me, it's the opposite. I was actually invited. I mean, for the third time, the third invitation only I accepted. Okay, was quite hesitant initially in joining. Was it difficult to follow the program? Okay, so it's actually not difficult. I think everyone who actually joined will pass the program. It's actually a lot of the syllabus or a lot of the questions, even if it's so heavy and you cannot remember most part of it, it is actually quite manageable. Okay, the questions are actually quite it won't be, I won't say too easy, but it's actually quite simple. And you got multiple choices. I mean, multiple attempts. Even if you didn't get the actual minimum number of correct answers in the first attempt, you can actually have another 3, 4 attempts. And the 3 or 4 attempts, you can actually just concentrate on those you haven't answered. It's all objective questions. No, I don't think there's any subjective questions. So actually, it's quite easy. And there's no contract or was it difficult program or working? Okay. Study leave. I didn't take any study leave except for the leaves that I took for the workshops. Okay, so that one just cuti kursus biasa. And then contract, no, there's no contract or bonding because it's actually Sandwich University sponsored the cost. So there's no fees that needs to be paid there. So there's no contract or bonding in that sense. Have I answered everything or have I answered the questions uh, according to kenapa yang bawah chat ni semua tak keluar?
Ada doktor. Di ruangan chat ni ada.
Oh, it's chat. This one is
Dekat
question
chat
and answer.
dengan
Okay, okay,
Q&A.
okay.
Dia datang serentak.
Okay, 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 okay. So macam mana nak tengok chat? Banyak sangat ada chat. Boleh dengar, boleh dengar. Chat. Just scroll down jap.
Okey, mungkin saya boleh baca sikit lah untuk doktor. Ada antara
Okay.
awal-awal tu dia tanya, can we have the presentation slides after sharing? Kalau
Good.
doktor ni saya boleh share lah kepada mereka yang
Okay.
minta lah slides
Yeah,
presentation
okay.
tu.
Yeah, for me, I have no problem sharing, but the slide that I share to Urus Setia is probably a lot of the picture that I put in actually cut out because apa tu nak kecilkan file.
I see, I see.
So but the apa tu the content is still there.
Alright.
Slides,
Okay, and then
slide
dia tanya, in general, the course is out campus
out
mainly
campus.
except the last workshop.
Out campus meaning because there's no campus. Out campus because the first two workshop is also outside our stations lah kan because for example I'm in Tawau I need to go to KL to actually go to the to if you say out of the country yes out of the country yes overseas yes the last workshop is the only one out of I mean in overseas but for those outside they have to come to Malaysia so that's probably the advantage that we get here. So, because two of the advantage and then as I mentioned yang baru punya ni they change it the second workshop is actually uh, online instead. So probably there's only one workshop here and then the other workshop. How do we apply for visa? Visa is just the normal procedure visa. I think the category is B2 or something like that. You have to go through the uh, website to apply for visa within the US Embassy. Okay, there's a full detail on how to apply. Okay, and you have to do that quite early because we're not too sure because you need to have an interview also when we want to get the visa. So you have to apply, they approve, you need to pay for the visa, and then you need to arrange a meeting for the interview. Okay, so that's visa. Sponsorship. Okay, I mentioned just now. Okay, you can get the sometimes I'm not quite sure because they don't open, they don't tell a lot of people regarding the sponsorship. So like our batch we had three, and then for the rest you can apply for discount. You will need visa online. Okay, dah ada orang jawabkan. Thank you. Shamala, is it my batchmate? How do you apply for visa? Oh, banyak Shamala dah tolong jawabkan. Thank you. Okay, any research component? The capstone project is somewhat called a research component. So that's the only one. And it's actually also not too difficult to pass. Is it more beneficial to private side? Personally, I think yes, we're more beneficial to that because there is that component of the financial component or where you need to how to get profit, limit losses, all those part, yeah, full time or part time. So it's considered as part time. No? Any more questions that I haven't answered? Bahagian kompetisi menyalas permohonan kos. Actually, permohonan kos is individual. You apply straight to in the website itself. And after that, if there are any claims that you want to apply, okay, that one probably you can talk to me personally because ada a few ways actually. So I'm also not aware which is actually the proper way, but there are a few ways. How long do you spend in Boston for a workshop? So the workshop is also 4 days there. Okay, so for me personally, I stayed there 1 day before and 1 day after. So about a week. Ballpark figure cost. Okay, since I don't have to pay for the course fee, okay, I mean the exam, I mean outside the course fee, I think almost 10K, I think, and I'm going to, because I need to get the tickets, the flight tickets myself first, the accommodation, even the accommodation, I took probably the cheapest accommodation available. Instead of staying in a hotel, I stayed in an Airbnb. There's a lot of Airbnb there, and I walked most of the time to the course. Okay, and then there's quite good amenities for public transport. Even to the airport, going back to the airport, I took the train, and the train somehow was also free. The conductor didn't want to charge me, so I saved there also. How long to complete the course? So the course is almost exactly 1 year. Other delegates are from private sector. Not really. I think we have quite a number from KKM. Out of those 15, I think almost half is from KKM. Class secara live and recorded. Yes, we have both. There are live classes and also recorded. Live classes usually at night because in Harvard the time difference is about 12 hours. Okay, so about 8 p.m. here is about 8 a.m. there. So usually it's around the 8 or 9 p.m. Will it be beneficial for family physician? Actually, as I mentioned, any is more if you assume a leadership role in your organization of an organization or any organization, yeah, there is benefit, but cost wise and also the benefit wise is different for each organization. Okay, what do I personally gain after going for this course? Okay, so first of all, after finishing the course, I think the main thing is the main feeling I get is actually overwhelmed because as a clinician, as a hospital setting, we have a lot of departments and we learn a bit here and there about almost everything that is to know about leadership. So, for example, I feel that I can contribute something on the quality department. I feel I can contribute something on the patient safety. So there are a lot of things. There's lean. So we have penyelaras untuk lean. Kita ada penyelaras untuk ini. So it feels like I can do something to actually help out in all this system. So, but as a clinician, we cannot actually be involved in almost everything. So at this current moment, I'm still thinking on how is it that I can actually contribute in all these aspects of the departments and also the initiatives in the hospital. So in that sense, I think I'm still a bit overwhelmed on how to contribute, but start small. I think it can be actually useful. So that's why I said probably the cost is probably not uh, beneficial if you are actually not holding some form of administrative role. If you want to apply through Sunway first or through KKM. Actually, KKM is not involved in the course itself. So it's actually an external course. Okay, it's under Sunway. It's a collaboration between Sunway and Harvard. So the through KKM is probably the cuti-cuti itu semua lah. The travel. Okay. Can we claim travel from PTJ? Yes, but I think there are ways that you actually need to apply, okay, and see whether it's gonna be accepted or not. Okay, so it's different because if for me, I was actually elected to join, so that's why I claim from the PTJ. So for those who are going personally, I think that's a bit more difficult to actually claim from the PTJ. And do you have to have a project before joining? Not really. The capstone project can be actually a theoretical project. You don't need to have a proper project that's ongoing, or you can just plan a project. Okay, so the project for my project is actually a real situation in my hospital, but it's not actually a project that I'm actually doing. So I just find something that I can improve upon and what are the measures that I need to take, what are the deadlines I need to set. But actually, I didn't actually do the actual project itself. So yeah, you can actually wait until you join and get a project, or you can use a existing project. It doesn't matter. don't need actual data. Data, yeah, actually for me, I do have the data. Okay, so theoretical, for example, mine is actually the waiting time in the venue section services. Okay, so I'll just get simple data such as uh, how is the appointments being taken? Why is the time taken for patients to actually wait for venue section? Okay, all those sorts, and then from there it's easy to present because it's difficult to um, make up data for any for a project. So certain things probably you can actually do and or use, or you can probably use existing data, but theoretical, well, what I mentioned here is actually you do not need to actually perform that project, the actual project. Okay, you can just do a proposal and probably just put there what are the steps that you need to do. Okay, so you don't actually need data after you done the I mean after you've done the intervention or something like that. Okay. So you just need to show, I mean, you just need to present what are the interventions that you're going to need to do, who are the stakeholders, who are
Ya, ada soalan lagi ke yang mungkin ingin diajukan? Okay, ada lagi soalan ke? Kalau tak ada, dikongsikan slides dan juga borang kehadiran untuk hadirin yang hadir untuk hari ini untuk mengisi dan juga untuk slides sebagai rujukan. Alright, okay. Saya rasa itu sajalah sesi kita untuk pagi ini. Terima kasih diucapkan sekali lagi kepada yang berusaha, Dr. Sazalin Deliza bin Husaini, yang sudi berkongsi mengenai prosedur dan juga apa expectation untuk kita memohon kursus-kursus anjuran institusi antarabangsa khususnya. Dan terima kasih juga kepada warga KKM yang sudi meluangkan masa pada pagi ini untuk mengikuti sesi perkongsian ini. Dan sekali lagi saya um, tekankan di sini, pihak kami ada berkongsi pautan slides kursus dan juga borang kehadiran untuk uh, warga KKM semua isi bagi mendapatkan e-sertifikat yang akan pihak kami edarkan tak lama lagi. Okey. Jadi mungkin saya rasa itu sahaja perkongsian pada pagi ini. Sekali lagi terima kasih kepada Dr. Sazalin di atas sesi perkongsian yang cukup-cukup bermakna, dan semoga sesi perkongsian ini akan menambah ilmu, pengetahuan dan juga memberi manfaat kepada kita semua pada pagi ini. Jadi sebelum saya end, mohon siapa yang masih lagi belum isi kehadiran untuk berbuat demikian, dan pautan slides juga telah pun dikongsikan untuk rujukan semua.